Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. We have an amazing returning guest to our show today, Patricia Ladis. Patricia is a physical therapist and founder of Wise Body PT. She is also the author of this lovely book right here, The Wise Woman's Guide to Your Healthy Pregnancy and Birth, and chair for the Global Wellness Institute's first 1,000 Days Initiative for Perinatal Wellness. So, Patricia, thank you so much for being on the show today with us again, and welcome to the show.
Thank you so much for having me again.
Of course. So Patricia was on the show with us, and she specifically spoke to us on sort of like the pregnancy part of the book that we are talking about today. But today we wanted to cover two different angles. One is the postpartum period, because it's so very important. And once postpartum, always postpartum, right? That's what pelvic floor PTs say all the time.
Exactly.
So that's such a crucial piece that we want to cover today for the audience. And then the other piece is a study that Patricia's working on. As PTs, you know, we're always thinking about reading research, looking up research, and then implementing, taking courses, continuing education, and putting things together. But the more important part of all of this is the research behind the work that we do that's evidence-based. And so I'm super excited. I actually don't know too much, so I'm excited to hear a little bit about what you're working on today in the research and the literature, and how we can all learn a little bit about it. So why don't we get started with postpartum? So I have a couple of questions off the top of my head, but before we dive into them, what was your experience writing the pregnancy piece versus the postpartum piece in the book?
Well, what's interesting is that a lot of people will have more issues or get care sometimes postpartum. There are, so it is more of the bulk of what I see. But what we know as PTs is if you don't do things before you get pregnant and be smart during your pregnancy, then you'll end up with those problems later on. So there's so much that creeps up in postpartum, but the book will address those things to try to prevent it from before. But needless to say that, we are always trying to help ourselves at every stage. Things start to yell at you if you didn't take care of them, right? You might have been able to get away with it a little bit earlier. So postpartum really was at the heart of one of the driving forces behind this book, is to make sure that someone actually has a smoother postpartum experience.
Yeah. And as pelvic PTs, I think that's the piece that we always hear all the time, right? Somebody comes to us postpartum and they're like, they learn this whole new movement strategy, a whole new way of functioning. And they go, man, if I just wish I could have learned this before I got pregnant or while I was pregnant. And so this is why I love the book. But before we started, I was showing Patricia how many wears and tears that were on because I had read it a couple of times. And
well, it's meant to be like that, to refer back and forth to, because it's so thick, right?
Exactly. I love going to the pieces that I think that patients will understand really well, to help them be like, hey, here's this book, go get it and check out this particular section, because it really describes very well what we're talking about in this stage of your pregnancy. So it's easy. Here it is, go.
Exactly. But, I always talk about this, this stat, which is basically that women in some European countries, specifically France, get 12 visits with a physical therapist to their home postpartum, covered by insurance. And it's just the normal thing. After you have a baby, you need this service. And that's kind of now starting, you start to say to yourself, why don't we have this? Why don't we have this in America? Why this is a normal thing that we actually do need support. A lot of times, patients will have baby showers and things like that. And I'm telling them, put on your registry, postpartum doula visits, right? Or home physical therapy, visits, something almost like a gift to you, for someone to come to you to support you during that transition, because that's a key thing.
Absolutely.
And I'm very big about the first 40 days. it's something that culturally, because I talk about it kind of almost in the side, margin, little tidbits of information and from all around the world. And actually, we now all know about quarantine, right? But it's 40, which is basically 40 days. And classically, it was a period of time where the sailors from their travels would have to wait at the boat for 40 days to get through whatever, like, so that they wouldn't spread whatever illnesses they might have gained on their travels. And so now we have this 40-day period, 40 quarantine, that actually has been told for ancient generations over and over again on many cultures all around the world before they could even communicate with one another, where everyone in the tribe, like all the women, come and they join in and they go to the woman's house and they take care of everything for her. The only thing she does is eat the food, the wonderful warming foods that they're making for her, not really do that much, and then work on resting and connecting with her baby, and not having to do the laundry, not having to clean up, not having to even go up and down the stairs, just literally resting and calming down. And what I find is that people that have a strict sense of that actually heal faster, and they don't turn on the stress response. So they don't get cortisol. When you get cortisol, you're going to have that 5 to 10 to sometimes 20 pounds that you cannot lose after baby, because your body's in stress mode. It's like, I got to hold on to everything. Something's going down here. I'm not going to get back to normal. I have to be in my, protective state. And that's not good. So no matter what you do, you end up not having, that great of a postpartum, kind of back to yourself journey, which is what everybody wants. So I always talk about that.
I love that. And that it's just really important to make sure that we are talking about that. And because sure, maybe we don't have like a randomized controlled trial of, is that even ethical to get women to be like, hey, you 1,000 women go and work out and do the laundry 5 times a day and do this and do that. And then the other ones, you get doula support and you get this and you get that. Like, I mean, it would have to be a retrospective look at people and like self-report really. And I think that's why a lot of the stuff surrounding birth, you can't really take a look at it and assign people medications in a placebo way. To come up with this information. A lot of this, like Patricia just talked about, it comes from these cultures that are ancient and that are coming from, across the board. A lot of people talk about this. It's not just a random one-off thing that one society has done. And I mean, just speaking personally from the Indian culture as well, one of the things is that around like 30 something weeks, depending on the pregnancy. So it could be anywhere from 32 to 36 or 37 weeks. The birthing individual will go into the mother's home and stay there for about 3 months. And so everyone lived, if she wasn't already living in, a kind of a joint family situation in that perspective. Usually what will happen is the woman will get married and will live with her husband's family. And then she will leave that husband's family to be with her mother in that joint family household with her grandmother and her aunts and uncles and her, cousins and family members and women. And exactly like you just said, everyone helps and takes care of everything for her. And that's she's given that opportunity to rest and relax and make sure she connects with baby and all the fun stuff. So just echoing off of what you just said, I think that it's so important for people to, more than anything, just listen to their bodies. And I think that it's really important to make sure you cut out all this noise of what's expected of you in society and really just tune into how are you feeling? How is your body feeling? And what do you want to be able to accomplish? And what are your expectations for yourself as well? And take a hard look at what is that going to look like and set yourself up before the birth to make sure. And I think that's I love that about the book, is a lot of it is, preparing and making sure you have your support system in place, or having this or that in place, so that you can have a little bit more ease.
Exactly. And, I think the idea that like, oh, you just had a baby, I'll leave you alone. It's like, wait a minute. No, I need your help. It's changing the culture to not ward off the woman. Also, right. Is inviting that support. So I talk a lot in the pregnancy chapters, like get your support in check, get someone if you don't have family close by, if you don't have the situation where you're going to be living in a home that everyone's going to take care of you, get as much as you can. Get that meal train going, right? Get that, the variety of things that you might need. Maybe you have to stock a bunch of soups frozen in the freezer, but prepare yourself for success and not just, okay, I have the baby, the nursery is ready. Like, no, baby might be sleeping right next to you in a bassinet for 3 months, what is it that's the most important? It's actually that you're nourishing yourself again. You're going to lose a lot of blood. You're going to lose a lot of fluids. You're going to have a hormone shift. You're going to have all sorts of changes to your actual physical body. And if you get back to things too soon, your foundational, your chakra is just opened up, your grounding chakra, right? You have pelvic floor tissue potentially tearing. Sometimes it's a C-section. I mean, there's so many variety of things that go on in that birth. And I personally have had all 3 births, right? So I had a vaginal birth without an ounce of medication. I had a C-section, and then I had a vaginal birth after cesarean, a VBAC. Both of my vaginal births were 9 pounds. I mean, please, I can't. But of course. And then my middle one, which, what came early, and that's why it was a C-section, was a 6-pounder. But the main thing here is that I kind of tested it a little bit. I'll tell you, after having 2 kids, I was like, oh, I feel okay with the third one. I was like, I'm just gonna, I think I could do the stairs a little more. I think I could maybe do a little bit more than I did with the other 2. Why not? I did fine, because I was very strict with all of these different things. And I bled the longest and kind of had lower energy coming back, because I always went back to work about 3 months after. And so I tested my own theory, and the kind of the Greek heritage is my parents are both from Sparta, so I am Spartan. Yeah. So that was a strict thing, and there are a few things. There's certain things you eat, certain things you avoid, certain things you do. But it is really about the woman really doing nothing but connecting with their baby, not even changing diapers, having somebody else to kind of handle everything. You could change a diaper. I mean, I'm not saying you can't, but it was really just about rest. And I have to say that was eye-opening to me, because I was like, wow, I've been through this twice now. My body knows what the hell it's doing. It was fine the last 2 times, whether it was C-section or not. And here I am, not as great. And I knew what great felt like in postpartum, having done all these things and being really important, keeping it of high importance and planning appropriately. And then I tell my patients, no, you really do need to listen, because you will heal better, you will heal faster, and you will have less problems later. So I have a lot of women that, will say to me, well, my friend went back to exercise, this, that, the other. I was like, well, ask her if she leaks urine, and they're like, oh, I think she kind of still, whatever. It's I have seen so many women 5 years postpartum, 2 years postpartum, 10 years postpartum, and they're still having pelvic floor issues. And I ask them about their journey during pregnancy and after. And, sometimes there has to be a complication during birth, and there might've been pelvic floor trauma. That's definitely a thing. But sometimes it's just I don't know, everything went well. I don't know. And then when we go back and they're like, oh yeah, I was back on the elliptical machine 2 weeks later. And I'm like, oh my gosh, you don't even know how to get in touch with your diaphragm again at the 2-week mark. You don't even remember how to engage your pelvic floor and your transversus. You need to have all of these things as precursors. And just because nothing's screaming at you doesn't mean that you're doing that well. Right? So she didn't listen to the cues of her body. And then she never really fully recovered a stable, strong circuit of muscular activity to fully support whatever she wanted to do. Because I want you to get back to anything you want to do. You want to run, you want to win a gold medal, you want to do tennis. I mean, that's kind of how I got into this, is I was treating professional dancers and the professional tennis circuit. And all of a sudden, the women weren't retiring. They were like, I'm going to have my baby and I'm coming back. But nobody knew what the hell to do with them, because no one was coming back at that level post-pregnancy. So that's when I did my deep dive back in 99, kind of taking in all of these courses and going around the world and learning about what's the latest and greatest, and seeing the studies and noticing how little of them we had, and just trying to figure out how to help support this population. And what I found was the most successful ones coming back were the ones that adequately rested, did really good small muscle group foundational training, and then went back to their thing. I mean, you know how to train. If you've won medals in the past, if you're a pro athlete, if you're a pro dancer, you know what to do to do that. But the transitionary step is the deal. That's where gold is, you know? So that's kind of what I dived into in the book for postpartum. And that's what I think we're missing enough information on. And that's why I was so thrilled when they asked me to design the exercise program for the first ever early return to exercise post C-section for Weill Cornell and HSS. So in combination, we have a whole OBGYN team, and then we have the orthopedic team, physiatry really. And then I designed the exercises. Women get, it's a pool of about 200 women, and we're going to get, half of them are going to get videos of exercises to do at the 2-week mark, 4-week mark, 6-week mark, 8-week mark, 10-week mark, 12 weeks. So all the way from 2 to 12 weeks, and it progresses slowly. But the key is, how are you breathing? What muscles are you turning on? How are you turning them on? Okay, now let's use all of them together and do this movement, blah, blah, blah. It's not like take your weights and let's go, Jane Fonda, none of that. So it's really about regaining the circuitry, the timing of these muscles, layering on your glutes, layering on your glute med, getting all of these kind of great muscle groups to kind of kick in symphony with one another, so that you don't have any room for pelvic floor going out, or so much pressure from the diaphragm that you can't turn on your transversus, your multifidus, your pelvic floor, So all of these things to re-educate the timing and the turning on of muscles that were dimmed. The light was dimmed on these muscles during pregnancy. And depending on how you were carrying, you might have even had some pain or some bony alignment things, or potentially some scarring if with delivery. So all of these things. So we had to do it in a more uniform case. So that's why it's only C-sectioned births, just to kind of keep it on a little bit more of an even playing field, because a vaginal birth can mean very different things. There's too much variety there, so it's a harder group to study. So hopefully we can kind of have another study. But we did the pilot, and it was very successful. So now we're doing the real study. So the pilot just finished, and we proved our proof of concept that women can have a difference if in mental health, overall well-being, pain, and functional capacity. So the hope is that we can get a real, we tightened it up, we added some things, and hopefully we will be coming out with that within the year.
I have like fireworks going off in my brain in the background. It's just like boom, boom, boom. This is incredible. I am so happy that you're doing this for our field, but
it's so sad that it's 2022 and we don't have this study already.
I know, but I think that you can touch on this, Patricia. There's a couple of reasons why we don't have this study like this.
Yeah.
Right.
Yeah.
That goes into
we did actually, absolutely. We did actually ask the residents and the OBs before we did the study. We did like a little poll. Why is it that you tell women not to do anything for 6 to 8 weeks following baby? Like no exercise. They tell them don't do anything. I literally had one of my patients get yelled at by a nurse that called her after the month, at the month mark. So she was 4 weeks postpartum. She said, yeah, it was so nice out. I went for a stroll with the baby. What are you doing walking? Like what? She's like, I ran this day that I delivered. I ran all the way through my pregnancy and up until the day I delivered. So here I am, a runner ready to run again. And I'm like, oh, I could go for a walk. And then she gets to the 6-week marks and they're like, yeah, you could go back to running. What? Like what? I mean, it's just so, it's just literally like on a piece of paper or something. Mm-hmm. It's just not nonsensical.
Yep.
So we're trying to change the narrative. So it's very challenging, but I hope we can do it.
I think we can. It's a deep conversation, actually. It's interesting that we're talking about that because it's a society problem. It's a American society, real, there's listeners who are listening from all over the world right now, but in the United States of America, we have this huge problem. And I think it's really like a big systemic problem where women were like at home and like back in the 20th century, like just making babies and wars and making more babies and, you know,
Giving birth in the fields.
giving birth exactly. And then we like, we're like, you know, women's empowerment movements and all these different like historical things have happened. And today, I mean, Patricia and I live in New York City. We probably work like 120 hours a week. Do we even have 120 hours a week? I'm not sure, but that's how much we probably work in a week. And we're doing a lot because our society right now allows us to do this. I hate to even use the word allows us to do this. So sad, but we are able to work on many, many different things and run practices and be educators and do all this variety of stuff. And Patricia has 3 children and successfully is able to manage all of these things in different capacities. And then it's like, well, you forget the one piece that this is the population that also has to go through the birthing process, sometimes multiple times in their life. And, you know, we're charging ahead with this whole like gender you know, equality and gender, you know, conversations, but the piece that's very, very just physically different is this one piece and I mean, there's a couple of different pieces, but this is a one big piece that we need to get on the same playing field with. And so the study, I think, is such a good way. Like when I first heard about it, I was like, oh yeah, because these are the things that are missing to help change the conversation where, yes, it's different. I mean, it starts from, you know, even from a financial perspective of maternity leaves and paternity leaves. This is a huge conversation, but what the study is doing and what Patricia's doing in her work is that trying to figure out these little puzzles that will help people understand that, well, while we need to talk about gender equality, you know, financial capacity and a career capacity and all these other ways, we need to make sure that the support systems in our society are there to help figure that out for everyone, right? I don't know. Jump in.
Yeah, I mean, really, I think it's first of all, the one step in the right direction we're going in is the fact that there is now 12 weeks maternity leave with paternity leave, and employers are forced to kind of stick with that. So that was changing since 2018. It was progressively getting more. It was like started at 2 weeks, 4 weeks, whatever it was. I don't remember the exact scale, but now I think we're at 2022, we're at 8 weeks, which is like 12 weeks, which is fantastic. And you're getting paid for part of that. And you have job security and all of that, because in the beginning, people would not even say that they were pregnant, you know, until the very, 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 very end, and be nervous that if they were up for a promotion. I mean, this is a very deep conversation, right? So we're trying to change the stigma around, this is something that I want to do. This is something that people are struggling, right? The infertility is up significantly, and couples still want to have a baby, and they should have the time in their job to be able to do that and not push it all the way to the brink when then they do need fertility treatments, because now they've said, oh, I can't, you know, one of the testimonials in the first few pages of the book is from Laura Gentile, who basically is the founder of ESPNW. And, you know, she said to me, and I was, you know, we got in touch about a few things, and she said to me, you know, I never thought that I was ready to be a mother until I got the VP job, until I got the president. I got that, you know, like if she just kept pushing the envelope, like I'm never going to get these jobs if I'm a mom. And that is a big deal, because she should be able to take a gap from society, do her thing, and then come back and still be up for all the wonderful promotions and different things that she is perfectly capable of doing and has done a fantastic job doing. And I think what that I feel is number one, is not having the stigma of taking time when you're in a relationship with someone, really, or not, or you're just at a point in your life where you want to have a kid. You should be able to take a leave, do it, and be supported during that process, because women who are pregnant should not be feeling like they're walking on eggshells. That's really bad for the health of that fetus, really bad. We know epigenetically how not great it is when you're not in a supportive situation, when you have a lot of stress. These things are very important, even in the pregnancy. So now postpartum, we need to probably start pushing for legislation to get some care at the home. You go for a hip replacement, you get a certain number of visits with a home PT, checking that your bathroom is safe, checking that you can move that hip or knee or whatever, replacement you got. Why aren't we having that for women? This is, a very important thing. And I think it's we could argue, did we have this much postpartum depression as we do now? I've taken all these courses in perinatal mood disorders is what it's called now, because it's anything from baby blues to complete postpartum psychosis. And I've listened to mothers' stories and healthcare practitioners, mothers' stories, of going down this path of losing their mind, essentially. And you say to yourself, if they were in a supportive, loving situation, given the right tools, support is the number one thing to amplify your chances of having a healthy baby. And it is also what helps you feel calm, feel sound, stay in the parasympathetic mode, where it's rest, digest, heal, where it's, I'm not going to have a freak out moment, where it's, I'm not in that anxious state. So we want to understand that when we set the tone during pregnancy to be supported, you're going to have a much easier transition in postpartum, but that it's not just, oh, you have postpartum depression, let's get you help now. That's too late. Now you have to deal with all of the flood, the dam broke and the water's rushing down. How about we patched up the dam before that storm came and now we're fine, right? So I cannot say that I have any proof to my statements, but my 23 years of clinical experience, the studies that I've taken, the courses that studies that I've read, and the courses that I've taken, and the professionals that I've had real honor of being around and round table discussions and grand rounds and being privileged to be part and invited to a slurry of very important conferences. You start to realize, like, if these women got the tools that they needed, they probably would not be getting to the point of crossing over from baby blues to depression. Because a lot of women feel that kind of, shift in those hormones. It's not gradual, it's quite drastic. And so there is some sort of something you're going to feel. But if you knew, what are the foods I'm supposed to eating, like right in the beginning, that I prepared myself for rest, is that depressive woman worried that in 3 weeks she's going back to work? Mm-hmm. Is there a situation at home that doesn't make her feel safe or supported? Does she feel that she's not going to be able to go back to her job at all? All of does she feel like financially this was a bad move for her? I don't know. There's so many stressors. So we have to really think about it before we step forward towards getting ready for this journey, iron out all of those pieces, and then you should get on the other side pretty well. But you also have to move wisely, sleep well, hydrate, have fun, put on your calendar something that gives you joy. I mean, this is like, the studies are coming out more and more, having fun and time of play, being such a great health marker. So, it's so many simple things that really don't cost money. But you need to, I don't know, the New Yorker in me is like, put it on your calendar. Because if you don't, it won't happen. So, put it on your calendar.
I love that. Yeah. No, Patricia, everything you're saying is so, so, so on point and wonderful. And the climate that we have today and the conversations that are being had in multiple different sectors of society. I think that this is a very, very important missing piece to the puzzle, is really bringing light to all of this, both the mental health, physical health. This whole conversation just around work, when you were talking, it just reminded me of a friend of mine actually who had a baby right before the pandemic. And, she worked in corporate America. And despite the fact that you're supposed to have, a pumping room or, certain checks
Right.
in place. It wasn't those pieces. It was actually the expectations from her bosses and her coworkers and her team, and, being a first time mom and being one of the only women in her in her
Division.
team, in her
Yeah.
division, in her company. And I remember having a conversation. I knew exactly where we were. We had that conversation, and she was like, I'm really, really not feeling supported. I'm not feeling
That's
it's
exactly
just like a
right.
different experience for me, like being not a mother in that environment, and now being a mother and being a mother to a newborn, and the expectations of me. And she's like, it's not that I couldn't have done this before, but I can't do that right now. It's just
Correct.
impossible for me to keep up with that right now, because I
Yep.
have to keep a human alive and well, and I
Yep.
don't have everything set up for me because of my circumstances. And she ended up leaving the workforce. She had her second child. She's very happy, but she's, it's that thing. Like, I had to leave the workforce because I didn't have the things that were set up for me. And
That's
for people
exactly
who
right.
choose to do that, at least it was a choice, right? Like, if you choose to leave the workforce, that's amazing. Great. Good for you. Everything's fine. But people who are forced to leave, and that's a whole thing that's been happening during the pandemic, is exactly what you said, is that support. The support is lacking. And the
Well,
support from the healthcare providers too.
that is very true. But my in Finland, because they had like a low population, they were incentivizing women to have kids and have multiple kids, and you can be out of work for 3 years and still get your job back.
Hmm.
Like I think you get health benefits during that time, like certain benefits. You may not be getting paid for the whole thing, but they give you a stipend for having the kids, like, all these things. And that was government down, right? It's just saying to the employers, like, just because we need these women to have the babies, and we need to give them space to do that.
Hmm.
And they knew that women were not having multiple babies because they couldn't take that time off again, whether it was financial or just the company, they were too far behind. So these are the things that I think need to start we need to start having these types of conversations. And I think some employers are spearheading that. Certain bigger, it just takes like one or two bigger companies to allow for that. And I think the pandemic has taught us one thing, that we can still be productive from home. And
Mhm.
that has been a true godsend. Now, granted, I've had a whole wave of, I could just tell you firsthand from my patients, most of them up until this point have been home. And now, as of April of 2022, 2 years later, they're asking them mandatory to come back at least 2 days in the office. So I think some employers decided, you know what, we're getting rid of our lease. Everyone's going to be working from home, for the next foreseeable future. If their job was okay to be online. And then others are like, we still need the space, still need the camaraderie, we still want you home, to come in. And so I do think that may have accelerated the conversation to at least allowing women to work from home a little bit more, because they can, while the baby is napping, and maybe they do even still have a nanny there, and they're, but they don't have the commute time to factor in. They don't have the pumping time to factor in. They could do things in their own home. And like, I used to like get back to my emails and I'm pumping and doing, it's the art of multitasking. So there's so many wonderful things that you could be doing, and getting more out of the time that you're actually sitting down to work, or during the working hours of the day, and then you can catch up, right? You can say, you know what, my kid has a doctor's appointment today. I'm going to take off an hour, and then I'm going to get back to my work, and I'm going to carry over that hour at 6 o'clock instead of, signing off. It's just flexibility as long as you get the job done.
Right.
But I do think I hear you on, it's just impossible to be at that crazy high level of work. And what I see also, when you're postpartum, but what I also see is that women, often something will go wrong. So something big will happen, and they'll actually have to take like almost like a medical leave off, whether it's they injure themselves and they're laid up on their back, or, something happens because their psyche knows that they're not ready to do this huge task and to do it at the capacity that they did before until the baby gets a little older. So it's kind of a moot point for many people in the workforce, but I do think that speaking one-on-one with your employer and saying, listen, I just want to set expectations. I am a mother now. I have this huge responsibility. I am doing my part in getting childcare and this and that and this and that, but this is what I can offer you. And they might just be like, great. Or they might say, okay, I need a little more from you, or this sounds like a plan. I highly recommend doing it at the grassroots level. Don't wait for legislation that's going to be years in it. Look at how long it took us to get even a postpartum exercise study. But so I highly recommend speaking to your employer, and then if things are really toxic, you could potentially, obviously go to HR or seek legal help, because that's not okay. There's all sorts of things that happen in the workforce that are not okay that we're shedding light on. Why not this?
Mm-hmm. Absolutely. I love everything you said. And I hope that everyone who's listening, it's a hard conversation, but I hope that you, firstly, I hope that you have this support in some capacity. And if you don't, which is unfortunately statistically the majority of birthing individuals in whatever capacity, whether it's at home or at work or in other places, to advocate for yourself, to talk to people, to have these conversations. We didn't even get into I guess you touched on it, that the nurse practitioner in your study had yelled at the patient for moving, but advocate for yourself and do your own research and talk to people and talk to your healthcare providers, talk to your bosses, talk to your family, talk to your friends, and set yourself up for success by setting some expectations into place that are right for you, because everyone's different, right? Everyone needs different levels and different types, or different, in some places more, some places less, and it depends on you and your situation, which part of the world you're in actually also. And so think about those things. But at the end of the day, last question for you, Patricia, is at the end of the day, what would be an ideal situation for a postpartum recovery experience? I know that's a really open-ended question, but if you could think of that,
I could, ultimately it's, you have a freezer stocked with soups, bone broths, healthy, organic foods that are basically soups or stews, right? Warming foods that have warming spices, all the things that help to amplify healing. That you have good, clean water supply, because if you're planning to breastfeed, you really need to stay hydrated. That you've worked out some form of a support system postpartum, whether it's your mother coming, a family member, a good friend, your neighbor, booking a postpartum doula, whatever it is, to come and help you. Cleaning lady, all of these things. And if you have, if someone's planning a party for you, a bridal shower, these are the things that you'd be signing up for. The baby just does not need all the stuff that the baby gets for bridal showers. So I would really highly recommend doing all of those things, which are highly important, and reaching out to those people before so that they can be there when you call. Hey, I'm feeling low. I've been doing a lot. I haven't had much help. Can you come help me? Speaking with your partner about the expectations, right? So that your partner can help and supplement and be around if you have one. And then at around, again, like I said, minimizing how much moving around you're doing. But around the 2-week mark is just, getting in touch with your breathing, having a nice breathing practice, napping sometimes when the baby naps, and making sure that you're trying to supplement because you're going to have disrupted sleep. So really catching that, having multiple stations to change the baby in with adequate diapers and change of outfits, because you don't want to be running around, your home or your apartment, even room to room, back and forth as a busybody. So you want to kind of have multiple areas of the home ready to handle a messy cleanup or a change of the whole baby, or the diaper situation. Having really good nursing bras and easy, clothing, minimizing your visitors for social, oh, I want to come see the baby. It's like, no, not until 40 days. After 40 days, you want visitors. I'm all about socialization, but you need people that are going to be there for you and for your healing and for calmness, not social getting into it and having to host per se. I'm just trying to think. And not getting yourself to go down those rabbit holes of like, what should I be doing right now? I'm postpartum. Let me look at the apps. Let me look at this. I mean, people want to give you things. They want to sell you things and they want to show that they're there to support you. But you want to look inward during this time and find peace looking out the window, taking a walk in nature, sitting outside for a little bit, just kind of doing things that really bring you peace and calm, not scrolling the internet, not, doing things that really rev up your system, not watching a thriller movie, putting on some peaceful music and having a cup of tea, really just giving yourself that time that you're going to be more in a quiet time. Just as the baby cannot take too much stimulation, neither can you, even though you've had a life filled with stimulation. And hopefully you don't have to check in with work at all during that 40-day part at all. And then slowly transitioning, now we're going to do regular breathing exercises. Now we're going to do some gentle pelvic floor core work, 2 to 4 weeks. Then we're going to start to move a little bit more. Then we might go outside for an actual walk and, move around and being mindful depending on your birth, like, how are your stitches? If you have stitches, are you feeling like you have the capacity to, do a little bit more, stand a little bit more, move a little bit more, maybe even think about some exercise. I'm a dancer, a former dancer. So for me, it's like, put on some music and kind of like, move around a little bit, just get your body flowing and just more of a easy kind of like getting into back to movement, just a nice transition back. And then eventually getting back to everything you love to do within a 3-month period, I think the key is that early phase and knowing that it's not all or nothing, that it's just a little bit each time. And staying in parasympathetic mode will give you a reduction in your injury risk. It'll and postpartum pain. It'll give you a reduction in all sorts of postpartum complications. I had a patient that ended up with postpartum preeclampsia. Interesting, very rare. You will heal faster and you'll get back to doing what you love faster.
I love it.
Yeah.
I love it. And also that, the only other thing that was perfect in that is don't compare yourself to anybody else. Just do your thing, girl, do your thing and do your journey and know that it's right for you. And so everything that Patricia said, I encourage everyone to get this book again, right here. Wise Woman's Guide to Your Healthiest Pregnancy and Birth. Amazing book. Gift it to your pals if they're pregnant. And
and Mother's Day is coming up.
That's right. And I'm really excited for the study, Patricia. I'm excited. Maybe after it's done, we'll have you come on yet another time. And
we can talk about our findings.
Yes, absolutely.
Which hopefully are positive, which I think they will be.
So thank you so much for being on the show.
Absolutely. Thanks so much for having me. And I think the only thing I would add is that I'm trying to get better about being on social media. So I'm trying to give some resources on my Instagram page. So if you wanted to consult with that at Patricia Ladis, maybe you'll find some interesting things. And if you're not pregnant, or again, we're forever postpartum, but if you're not pregnant or you're trying to conceive, I give a lot of information about posture and alignment, because that's really the key that I have found that has been the real silver bullet at preventing pain and preventing injuries during this journey. So
I love it.
Yeah,
I love
it.
I
hope you love it.
And I'll drop that on the show notes too, so people can follow and learn and join us on the journey.
Thank you so much for all that you're doing, Sneha.